Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe for updates. Let's look into the stimuli that affect the gastric secretion. So the first one is the stimuli that increases the gastric secretion. So what increases the gastric secretion? Increase is done by the luminal, neural and the blood-borne. So the luminal means there is a peptide and the amino acid. So there is a peptide and the amino acid. Next is the neural. The neural is the increased vagal discharge by the GRP. So there is vagal discharge. The vagal discharge is increased. So increase in vagal discharge, and this is via the GRP. So the first one is the luminal, that's the peptides and the amino acid. Next was the neuronal. The neuronal is the increased vagal discharge via the GRP. Then comes the blood-borne. So what happens in the blood-borne? The blood-borne is it includes the calcium as well as the epinephrine. So C and E, calcium and epinephrine. So all these, they increase the gastrin secretion. Next, we look at the stimuli that inhibit the gastrin secretion. What is the one which is inhibiting the gastric secretion? So under this we have the luminal. So luminal, it includes the acid and the somatostatin. So acid is present as well as the somatostatin. So acid as well as the somatostatin, and this includes, next is the blood-borne. So in both cases there was blood-borne, and here in blood-borne that inhibit the secretion. In luminal we saw it is the acid, then it includes the somatostatin. Then in case of blood-borne, that includes the secretin. So blood-borne, that includes the secretin. There was a GIP, there was VIP. So blood-borne, there was secretin, there was GIP, there is VIP as well as glucagon and calcitonin. To learn and grow daily like this, please do subscribe.